you say you had other questions?
Another question, yes, for the opposition. I guess one of the main emphases was the point that a bureaucrat was going to decide, some government bureaucrat would decide who gets the health care or not. But in the current system that we have in America, instead of a bureaucrat deciding, we have a committee who looks at your past medical records, and they decide whether or not you can receive health care. Even if you are insured, you can be, that's part of the percentage that he said were underinsured. People who have health care, but they still are denied their health care because of somebody who is, I guess, financially inclined or more likely to go towards a money issue than towards a moral issue. So are you saying, if you suggest that there's a bureaucrat in the government, what better is a decision maker in a private owned business towards giving health care?
Yeah. Okay, so I was back into the debate then. Were I to defend your system?
Yeah.
I'd say there are two types of discrimination in your system. There's kind of the completely illegitimate kind that Obama talked about in his address to the joint session of Congress, which was where you have health insurance, you get sick, and then your healthcare provider says, you didn't tell us you had acne when you were young, or that you were a victim of domestic violence, and therefore we're not going to give you health care, even though you've paid for it all these years. Like, that's completely illegitimate, and hopefully will be resolved by having a better competition between healthcare providers and having a public option, which presumably won't do that to people. Right. Therefore, if people aren't to flock to the public option, healthcare providers will have to stop doing things like that. Then the legitimate, in the eyes of your system, discrimination where you're poor, so you don't get health care. So it's not so much that an insurance company decides you don't get health care, but that you didn't have enough money. That's what decided you didn't get health care. Right. I personally think that is worse than our system, I think, because many people can't work their way up to get money, and you certainly can't, if you're already ill, work your way up to get health insurance. But I think it is worth pointing out that I find it morally reprehensible that in my country, if my grandfather needed a very expensive medical operation, and a bloke I know who spends all his time sitting on a couch smoking cannabis wants the same operation, they would let my grandfather die in order to save the young person purely on the basis of his age. Like the way it works is like your doctor just has to treat the person in front of you. So everyone who knows you just has to treat you. Unless it's something that's deliberately going to damage, like you wouldn't get a liver transplant if you're an alcoholic, right? Because the liver would get as a waste of a liver. But the people who decide who lives and who dies never meet you, don't know anything about you, other than that you're probably about 23 years old. That's it. And you're a male. They'd know those two things about you. Okay. So I think both systems have harms. I think it is probably worse to just let poor people die rather than to try and allocate on the basis of need, even in a flawed system. Okay. But great question. Thanks.
I have one more question, then I'll shut up for the both of you.
I just want to add one piece of the puzzle that it's so complicated we haven't talked about yet, is that more and more companies aren't providing the group insurance for their employees. And so when we're talking about the cost of insurance, if you're working for a company that drops their company insurance, then to go out and buy it on your own costs so much more, and that leads a lot more Americans not to be able to buy it. So there's that problem too. You have another question?
Last one.
Good questions.
Okay. Yeah, Fox News, and even MSNBC, we have two just dichotomized groups of news that just give a very skewed insight into the truth. But you do hear some truths from both their sides. It is true that we have a very, very, very respectable health system here. We do a lot of research and funding, that kind of thing. But it's also true that we are ranked very low by the World Health Organization in the rankings of best healthcare in the world. I just don't know. I never Wikipedia'd it. I never Googled it yet. But by what standards, or how do they judge the WHO? How do they judge who is the best in the world? How's it ranked?
Yeah, I mean, basically the WHO believe, as we do.
Oh, World Health Organization.
Yeah, sorry. Believe, as we do, that you judge healthcare by outcomes across the whole of society. So while you guys have these incredible hospitals, and obviously your R&D, I mean, science is global, so all your R&D, well, it's awesome that you guys do it, gets counted in everybody else's healthcare system as well, because they get to use the products.
Research and development?
Research and development. So Britain gets WHO points for America's healthcare research because we use the same equipment that you guys have developed. But the WHO basically look at it and say, well, you guys have the best hospitals in the world 15% never go to hospital, even if they've just, for minor things that would be easily repaired in every other Western country in the world. And the underinsured, bankrupted by the healthcare system, left to die because they had acne when they were 12. I imagine that's what the WHO is looking at.
Okay. All right, thank you guys.
Thanks. Great questions, though.
Come to the mic.
My question is, like, I'm here in the United States. My question is, here in the United States, everyone have the right, and everyone is treated the same way in healthcare, as in, like the same way they would treat teenagers, the same way they would treat an adult. But in the United Kingdom, it's like a youth have more rights than an adult in healthcare. Why? Is it not everyone have the same right to live?
It kind of goes back to what Andrew said at the start of his speech, that everybody does ration healthcare. There is a limited amount of healthcare resources. So if you're going to give a right to healthcare to people like we do in England, so that you're going to take taxes and you're going to turn that into a right for everybody to have access to healthcare, you have to have some way of deciding who gets the last pound of that spending at the end, the last dollar of that spending at the end of the year. So what NICE do, because it's very difficult to explain very quickly, is they take all the possible healthcare treatments in the world and all people in Britain ranked by age. I don't think they include gender, even though that would be quite sensible, but just age then. And they say, what's the most effective treatment per dollar that we have? So, for example, if you had a treatment that, say, I don't know, fixed a $1 pill that would cure a baby of a terminal illness, that's the first treatment you'd pay for in a national healthcare system, because it's zero cost, maximum benefit. You've saved a baby's life. And then you'd work through all the treatments, going through, the $100 it costs to stitch up my leg after I cut it, going through a $10,000 cancer treatment for a 60-year-old, and you end up with a $1 million treatment that will add 5 years of life to a 85-year-old. So you cure them of cancer, but in terms of looking at the probabilities, they're likely to die in 5 years anyway. So you, for that $1 million, only get 5 extra years for an octogenarian. And you say, so if you have spent your last dollar by then, so if you spent all the money you could have raised in taxes, if you spent it by then, they don't get that treatment. So the idea is, if you're a young person, curing you of a disease buys you 70 years of life for the same cost as we could get 5 years of life for an octogenarian. So, and that's the rationale behind saying old person dies, young person lives.
But at the same time, everyone have the right to live. So,
yeah.
So the question originally was that in the US, a teenager and an octogenarian or someone old would be treated the same. They have the same right to healthcare. You wouldn't treat them differently. And in the UK, we prioritise the young person over. Right, okay. The circumstances in that would happen is they would have to have exactly the same illness. So it's not like a young person with a headache gets prioritised over an old person with cancer. So it's the severity in that sense. But the reason slightly deny the premise of the question is that we have the equal right to health in the same sense that you're talking about in America, that everyone should, it would be nice if everyone could have it, and you can't just turn people away willy-nilly. But you only have a finite number of resources, so you have to choose at some point who you give it to and who you don't give it to. So while we're looking at at age with the same disease, you're looking at money. So if we have to answer the question of, if everyone's got equal rights, why doesn't an old person have the same right as a young person? The American system would have to answer the question, why does a poor person not have the right in the sense that a rich person has the right? So both systems are saying some people can't have healthcare, or some people are prioritized for healthcare over others. We just choose different ways of doing it. We choose the way that Dan just explained over how much benefit